While 2020 opened our eyes to many shortcomings, it introduced the importance of remaining nimble while navigating uncertainties. Organizations learned the true concept of always being prepared to pivot. At no other time in history can most say that in parallel with political uncertainty, racial injustice, health disparities, and a global pandemic, there was a heightened ability to be present personally and professionally. As a leader, it created more opportunities to revisit a few simple questions. What are we here to do? Who are we here to serve? How are we going to support our communities? I am joined today by two Carefirst Blue Cross Blue Shield leaders who have remained grounded in answering these questions throughout their efforts to create partnerships to support communities mostly impacted by COVID-19. Before we jump into our questions, could each of you provide a brief introduction on your role with Carefirst? Maria, we'll start with you.
Thank you so much, Sierra. I'm Maria Harris-Tilden, and I'm an Executive Vice President for Public Policy and Government Affairs. And I am on point to work with our legislative, governmental stakeholders and others in the policy community to advance access, affordability, and quality in healthcare. And I'm delighted to be here today.
Thanks, Maria. Destiny?
Thank you, Sierra, and thank you, Maria. Allow me to also thank Tony Draper and the Afro for hosting Black Business Matters and for partnering with Carefirst to prepare for today's events. The Afro has a strong team behind you, and this couldn't come at a more prescient time. My name is Destiny Simone Ramjohn, and I'm proud to serve as Vice President of Community Health and Social Impact with Carefirst. I lead our mission-driven initiatives to usher in and leverage Carefirst's time, talent, and treasure in support of eliminating health disparities and pursuing health equity in the region.
Well, great. Thank you both. I'm happy to be here with both of you today. Destiny, will you tell us about the early days of the COVID pandemic and the Carefirst offices? How did your team identify the issues, needs, and how Carefirst would respond?
Yeah, thanks, Sierra. So, the early days of the pandemic, about 12 months ago, we all remember feeling a great level of uncertainty. But I feel like I have to start by saying how fortunate we are to be able to answer a question like that. Nearly 500,000 Americans have died from COVID or its related complications and are not here to reflect on their experiences, including 1 in 735 Black Americans and close to 13,000 individuals in the DMV alone. And we honor their memories. Who could have known that last year? So to your question, in the early days for Carefirst, when it became clear that the situation would escalate in the United States, we immediately formed a task force that reported directly to our company's president, CEO Brian Pinnock, and his executive leadership team, of which Maria is a huge part. Brian and Maria are amazing leaders and among the most forward-thinking executives in healthcare, who asked us to prioritize our actions based on the health and safety of our workforce. Currently, more than 95% of our workforce is operating remotely, with all services and operations fully functional. We work to remove barriers to care for our members, covering all telemedicine costs so that individuals could receive primary care from their doctors as well as specialists. My work was focused on partnering with communities on readiness, response, and relief. And we did so in ways that prioritized exactly what our partners were hearing on the ground. We contributed over $4.5 million to community nonprofit organizations working to provide relief for health, social, and economic needs arising. And we also partnered with organizations like the Aramark cafeteria staff at 3 Carefirst facilities who were preparing and packaging cold box meals for organizations being impacted by COVID-19. To date, we have provided over 40,000 no-cost meals via that initiative.
Wow, thank you so much, Destiny. Can you speak a little bit more to how Carefirst has been investing in community health and why it has been so important to our ability to make an impact?
In a lot of ways, this is core to who Carefirst is. We have been working for years on programs aimed at better managing health outcomes for members in all of our plans. You know, one example would be our work to coordinate care of people's chronic conditions, to emphasize preventive medicine. All of that means spending less on healthcare and better overall health. And so many of the issues that arose or were exacerbated by COVID-19, including the health, economic, and social conditions in communities where people live, work, and play, meant that I had to put my public health sociologist hat on. You know, we have a saying that your zip code is a better predictor of your health than your genetic code. So our investments in the upstream determinants were really responsive as COVID shined a bright light on what healthcare knew already, that most of what contributes to your health happens outside of your doctor's office. So I'm really proud of the ways that we've responded to those health and social needs. I should also mention that we were thinking about institutional needs as well. Really proud of our Care Delivered initiative. We launched an effort, a $5 million effort, to distribute personal protective equipment at no cost to organizations that were on the front lines. To date, we've distributed close to 800,000 units of gowns, gloves, masks, and face shields, and we'll continue to do so in 2021 and beyond.
Thank you, Destiny. Continuing on the topic of forging partnerships in support of our communities, Maria, could you tell us about the public-private partnership formed among Johns Hopkins, University of Maryland Medical System, and Carefirst?
Absolutely. As Destiny said, you know, the beauty of working at Carefirst is in every instance, we immediately put the health and safety of not just our associates, but our community is paramount. So in the early days of the pandemic, we recognized that we have unique resources, we have data, and we also have operational supports that could be of great assistance to our jurisdictional partners, Baltimore City in particular. We also recognize that just given the demographics of the city of Baltimore, they were in a unique position to be disproportionately impacted by the pandemic. And so we immediately sat down and said, who can we partner with to support all of the efforts of the city? And obviously recognize that our large anchor institutions, Hopkins, Johns Hopkins Medicine, and the University of Maryland Medical Center would be the obvious partners to sit with us, and the city, also in partnership with the state, to map out a very strategic and intentional way of managing through the pandemic. And so in partnership with the mayor's office, and in partnership with our extraordinary health commissioner, Dr. Letitia DeRaza, we actually set up a very strategic oversight committee along with a task force with 7 different work streams, all mapped out to identify how do we get access to the best data such that the city could target and hotspot those areas that they could anticipate would be most impacted. How do we ensure that we as the Hopkins, Carefirst, and Baltimore City team ensured that communication was getting to the right populations with respect to the impacts and necessary behaviors to keep our residents safe. So we literally started the last week of March, put together a work group, created work streams, focused on our community partners, focused on data, focused on communications, care management, and more. Worked every day to check in, identify where the needs and barriers were, and very, very quickly responded. We recognized also that there was a lot of anxiety a lot of questions and unknowns with respect to how the virus would actually impact our residents. And I'm very proud to say that we quickly stood up a mechanism for the residents of not just Baltimore, but even the Baltimore metropolitan area in partnership with 211 for folks to call in, ask questions about the symptoms of COVID, but also gave them an opportunity to have access to clinicians. So very grateful for the partnership of ALMS and Hopkins, who did not hesitate in identifying resources that were immediately available 24/7 to the residents of Baltimore who were concerned and had questions, but did not want to expose themselves to healthcare settings if they didn't need to. So triaged on the phone and then provided with the appropriate guidance as to what they should do next. I would also note that as we're speaking to a group of business folks, we worked at Carefirst not only in partnership with ALMS and Hopkins, but we immediately identified ways that we could help our accounts, right? Provide resources about the prevalence of the virus, questions that could be answered but for their associates and their employees, and several accommodations that help them step through what we knew from a financial perspective were really, really challenging times. Premium holidays, accommodations on cost share and cost waivers were put in place, all toward a goal of identifying every barrier and addressing them in a meaningful and expedient way.
Thank you, Maria. So how will these lessons that were forged during the partnership be leveraged for vaccine implementation moving forward?
What we found, and Destiny can speak to this as well, what we found to be foundational to an effective response was communication. And communication not at a high level, but ensuring that there was a strategy and framework for communicating with our community in a very grassroots way. Identifying thought leaders across the city, identifying foot soldiers who had the trust and credibility with different areas of the city, but also different demographics of our population, who could, in a very, very authentic way, educate and be trusted to deliver those really, really important messages early on. It is even more critical now as we are stepping into a place where we need to better educate and inform our residents about the importance of taking the vaccine. There's a lot of swirl, a lot of inaccurate data that is, that folks are bombarded with on a regular basis, particularly in the Black and Brown community. And so we are pulling through the value recognition that our local thought leaders in the corporate community, folks that are listening to this conversation, in the faith-based community, they have a really important role to play to be those messengers about the importance of taking the vaccine when it is available.
Thank you, Maria. So looking ahead, could each of you share perspective on what Carefirst will be focusing on in 2021? Destiny, we'll start with you.
Sure. As we've mentioned today, throughout the COVID-19 pandemic, Carefirst has taken numerous actions to support the health and safety of our members, our providers, and communities. And those same principles will be on full display in 2021. We're focusing our efforts on supporting vaccine distribution. As Maria noted, we are 100% committed to supporting equitable allocation, as well as distribution strategies that prioritize Black, Brown, Indigenous, and related populations that are at risk. On a personal note, how many of us have uncles and aunts and grandmothers and parents that are still not ready? How many times have we heard family members say, I'm going to wait until the next round? I think it's Carefirst's position that vaccine availability is only beneficial to our communities if we can get shots in arms. So we're looking forward to partnering with other carriers, with the business community, with local governments to promote confidence and adoption of these vaccines as a tool in the fight against the pandemic. We know also that the social determinants of health are going to be exceptionally important, particularly for our philanthropic investments. So our team, building on a history of partnership and meaningful relationships with our communities, will be focusing on economic inclusion, on educational opportunity, as well as chronic conditions like diabetes in ways that help us eliminate health disparities and pursue health equity. I think that, ultimately, whether it's 2021, 2022, or beyond, Carefirst wants to be difference makers for individuals and families in this region. And we think by focusing on this holistic approach, it certainly will accelerate change.
Thanks, Destiny. Maria, any additional thoughts?
Yeah, I think we'd be remiss and not taking this opportunity to encourage and implore those of you in the business community to take a leadership role in advancing the messaging around vaccine hesitancy and underscoring the importance of your own employees recognizing and taking the vaccine when it is available. One initiative that we're particularly proud of that we actually just announced today is our Better Together campaign. And so with this campaign, we are asking our own associates to take the pledge, asking our associates to sign up for a pledge to get the vaccine when it is available. And in exchange for our associates pledge, we are working with Destiny's team. We're actually making donations to organizations that are on the front lines of vaccine response and distribution across the region. We know that we cannot do it alone with only with Carefirst associates, and so we are actually extending it to our business partners and corporate communities, and so we're inviting businesses across the region to also take the pledge to commit to promoting, encouraging, and communicating with their associates the importance of taking the vaccine when it is available. You cannot underscore how critically important, and particularly in our Black and Brown communities, for our own safety, for our family safety, for our colleagues' safety, for everyone to get the vaccine so that we can get back to some semblance of whatever the new normal will look like post-COVID-19.
Well, thank you both for taking time out of your schedules to share insights specific to investing in the health of our communities, as it continues to be such an important topic of discussion among many businesses. For the latest COVID-19 information, we encourage you at home to visit carefirst.com.